So a very warm welcome to everybody for joining us this afternoon. Thank you very much from wherever you're calling. We've got a lot to get through in today's session. This is the next in the EMIS Live series of webinars that we're running. This one is focused on managing flu season. I've got a number of colleagues and partners joining me today. So just a quick run through the agenda that we've got. I'm going to read through this because there's a lot to get through. So first of all, we'll discover how Patient Access's Flu Eligibility Checker can help alleviate practice workload by checking and directing non-eligible patients to contact their practice. We'll then walk through the patient.info content and decide which articles and which content will be most useful and best support the patients you have. We'll then explore two partner products, both MJOG and DocMel, and look at their innovative barcoding features that will enable practices to send patients their NHS numbers. Then hand over to Surgery Connect, where we'll look at how you can manage some of your flu clinic appointments and triage calls effectively with their cloud-based telephony system. And finally, to round off, we'll look at how you can reduce some of the risk of infections through contactless clinical assessments and examinations in care homes with the ARC Health solution. So without further delay, I'll hand over to our first speaker. It's Dr. Sarah Jarvis, a clinical director at EMIS.
Thank you very much indeed, Jamie. And I'm just going to start off by making it clear that actually the whole point of the eligibility checker is to direct non-eligible patients not to contact their practice. You said to contact their practice. Apologies. And I really hope we're going to make that clear during the course of the presentation. Not at all. I've been living and breathing this for several months, so hopefully I will be able to show you how. Next slide, please. So what we're looking at is our flu eligibility checker, which you can see there at the top of the screen. This is present on all users' home screens when they go in, and it takes about 2 minutes to complete. This is the second year that we have run this, and if we move on to the next slide, please, we can see what happened last year. Last year it was used by about 361,000 users. Now, of those, only 8% were definitely eligible for vaccination. I think the really important point to point out here is that the vast majority of those patients were patients who were wondering whether they were eligible, and they therefore might well have contacted their practice if they hadn't had the flu eligibility checker, and the majority of the patients who were not eligible were directed not to contact their practices. There are some patients who were directed to contact the practice, and we had extensive discussions with practices and with PHE on this. And for instance, we identified that there are some groups who might not be on the practice's list. So people who, for instance, were primary carers, or for instance, patients who had asthma, but who hadn't been picked up on the practice list to be eligible, because of course, as we all know, not every patient with asthma is eligible. Patients who have regular or intermittent use of inhaled or oral steroids are eligible, but other patients are not. And we did find that we had a proportion, a small but important proportion of those patients where the practice was going to be the one who needed to make the decision about whether or not they were eligible. Those patients were directed, as they have been this year, to contact the practice, but the majority of those patients were told quite clearly that they were not eligible. And we've got a really important list this year, which I genuinely hope is going to make a big difference to practice workload. But more of that in a couple of slides' time. If we move on, please. So this is this year. It was launched on the 9th of September 2020. I developed these slides 6 days ago after it was launched, which was on the 15th of September. I can now tell you that a week after that, we've moved from 81,700 users to 182,286 users in the under 2 weeks since that has been made. Now, for NHS eligible patients, if the practice has got flu clinic appointments that have been made available online, and of course, unless you're in Scotland, then you can tag your appointments as flu clinic or flu clinic under 4 or flu clinic over 65, so you can specify what kind of clinic it is. Then we will direct the patient directly to them. Do not pass go. They will be directed to that if your practice has flu clinic appointments available. If they don't, we are very conscious that this year some practices are not running walk-in clinics, and that some practices, for instance in Scotland, might be running most of their appointments through hubs. We've heard of a wide variety of innovative solutions to managing the problem of administration and providing those flu clinic appointments or those flu vaccinations. Some practices are working together, banding together with other practices and running a field clinic. It could be literally, in the case of some practices, in a field. There are tents being set up in fields, but also town halls, school gymnasiums and so on are all being used. Now, what we will allow you to do, and what we would urge you please to do, on your practice appointment screen, you can add an EMIS message, and that applies to Scotland as well. And you can then advise of your practice's arrangements. So we will be directing your patient to look at the screen where you have put up whatever your arrangements are. We are also aware that some patients are trying to book in when they are not now eligible, and that's mostly 50 to 64-year-old patients. So if patients do try and book flu clinic appointments directly, then again on that EMIS message you can add a note saying, you can say who is permitted to book an appointment. You can say, if you haven't received an appointment from your practice, please use the patient access flu eligibility checker, or please do not book an appointment, and that will prevent ineligible patients, we hope, from making those appointments. Next slide, please. So if we look over on the top left, we have categorization by age, and this is very much new for 2020-2021. We all know that there was a huge announcement made by the government, who love to give good news, about the expansion of the flu eligibility programme and the fact that they were going to make flu appointments on the NHS available to 50 to 64-year-olds. There are 6.8 million people in the UK aged between 50 and 64. What of course has subsequently happened, when the Public Health England Chief Medical Officer letter to practices came out, the will be available had changed to might be available, and that might be available was, we were advised, dependent on whether enough high-risk groups had been vaccinated and whether there were enough vaccines to go round. So we don't yet know whether those patients will have appointments made available to them. If they do, they should certainly not be prioritised now, as every practice knows, and as we know as well, and this is really important. So if you look at that top left-hand corner, that seems to be where most of our questions are coming from. 45% of the people accessing the checker are aged 50 to 64, and I suspect that these are patients who heard the announcement that they were going to be eligible but have not received a flu vaccination invitation from their practice. They would otherwise have been ringing the practice. So of those 182,000 patients, we have directed about 80,000 of them already away from their practice. That's, we hope, 80,000 phone calls which would have been made to practices and which are not being made as a result of the checker. If we move on to the next slide, please. What we can see here is this is what we are doing. If they do not have other eligibility criteria, and clearly if we have a 50 to 64-year-old who has diabetes or who's had a stroke, that will be a completely different matter. They will be directed to your practice's appointment screen to make the appointment or to look at what your practice's arrangements are. But if they do not fulfil any of the other eligibility criteria, they will specifically be told not to try and book a flu clinic appointment, and they will be advised what the criteria are. We will only be making appointments available if stocks allow, or if other at-risk groups have been vaccinated, and if that does occur, then it will be in November or December. We ask them to wait to hear from the practice for an invitation, or alternatively, because we know some of them are going to be coming back and getting antsy and wondering whether they've missed the invitation for the practice and would otherwise perhaps be contacting the practice, we also offer them the opportunity to sign up with patient access, and we will notify them the moment there is an update from the government on the vaccination status, on whether that will be offered for patients. Move on to the next slide, please. Just to remind you, by the way, I may have to step out just before this meeting finishes. So while most of the questions will be taken at the end of all the presentations, please do, if you have any queries, pose those questions now, and I will be happy to take them at the end of my session. But I will also, if there are other ones that come in later, answer them through the Q&A, because we are going to be collating a question and answer. So let's just take you through that question and answer session. What you can see underneath is that we've had, and Millie's going to be talking about this later, huge success educating patients on all sorts of topical coronavirus topics, but also, as you can see on the left hand side there, what's the difference between colds, flu and coronavirus. We are working very hard to keep up to date and providing reputable information and reliable information to patients, and we've had very, very popular articles on there, a lot of patients looking at those, so still a great deal of interest in coronavirus. Next slide, please. When they get on, the first thing will happen is we ask if they are checking for themselves or for somebody else. Now, of course, patients who are registered as proxies can go on and the proxy can register, can ask on their behalf. But if they're not, then we offer them the opportunity to sign up as a proxy. If, for instance, it's an under 16-year-old. We then ask them all the standard questions in patient-friendly language. As I say, this questionnaire takes a total of about 2 minutes to complete. That's the average time. We have absolutely gone with all the Chief Medical Officer's criteria, but we have been very specific about those high-risk groups to make sure that we are not inviting the patients who are not in those high-risk groups to register to make appointments now, because we know that that is not yet the case. Next slide, please. This is what happens if you do enter that you are 50 to 64 and you do not have any criteria. So we make the point, as I say, you may be eligible, but vaccination isn't available depending on national vaccine supply. You may be contacted. If you'd like to be notified about availability, you can sign in, or you can complete the eligibility checker again. And if you notice at the bottom, we also remind people about coronavirus symptoms and get them to use our online coronavirus checker. And we also remind them that they need to wear a face covering when they come into the practice. Next slide, please. We've also on Online Consult got a new flu vaccination hub, or a new topic. So if you do have Online Consult, you can choose to make this topic active. We have a lot of background information about flu. We have information about flu vaccination. We have specific information about flu vaccination in children and why it's so important for healthy children to be vaccinated. And all that information comes from our patient.info site, which Millie will be talking about shortly. And in addition, it has been updated for this year. Now, we then make the point that they can submit information about booking a flu vaccination, so you can choose to make that live. Next slide, please. We ask these questions. Clearly, they're not displayed like this. I've cut and pasted them from our page, but we ask them if they've had an invitation this year or last. Yes, then they can continue to book it. If they haven't, they're asked if they've used the eligibility and advised they are eligible. Yes, then they can continue to book it, but if not, they are advised not to book it or to complete the eligibility checker and only come back if they're advised they are. We also ask coronavirus questions, and we also look for consent. So patients have got written consent submitted to the practice to have the flu vaccination. Next slide, please. And then finally, we ask about serious adverse reactions, which may or may not have been recorded, and serious allergies to eggs. In addition, we even ask, and this was at feedback from some of our practices, particularly I think these were practices who were planning to have drive-in clinics or drive-through clinics, to have a preference for which arm they'd like the injection to be given. So that's it from me about our flu eligibility checker and our addition to Online Consult. If there are any questions, please don't hesitate to ask them. If you want to ask them in the next half hour or so, I will continue to be online for that time. But in the meantime, I'm going to hand over to Millie.
Thank you very much, Sarah. Just we have got one question before you disappear that's just come through.
Yep.
It says, can a patient still book into the flu appointments we publish on Patient Access, even if they are not eligible to receive one?
So the answer is we cannot stop patients from booking appointments in the same way that we cannot stop patients from booking, for instance, a cervical screening appointment because they can't get an appointment with a nurse. And we know that does happen. However, by adding that message at the top, you can let people know that even if they turn up for that appointment, they will not be given the vaccine. So it should direct patients away.
Great stuff. Thank you very much. That's the only question for now. Just a quick reminder, on your screens, I think in the top right hand corner, there'll be a toolbar and you can ask questions in there. Just simply type it in and we'll pick them up. But Sarah, if there's any more that we get, we'll feed back to you, and obviously we'll provide answers to all the attendees afterwards.
Okay, we've just had another question, a couple of other questions actually that have come in. Some patients who we invited as eligible used and were found not to be eligible. We have very specifically used the exact wording on the Chief Medical Officer's letter to patients. So I'd be very grateful if you could submit something through Patient Access Support and say exactly which patients they were, or indeed go through the eligibility checker yourself. So for instance, if we had a patient who had, say, asthma, but who had not been invited last time, then they would be advised to contact the practice to check whether they were eligible or not. If we had a patient with asthma who was invited last year or this year, and we then ask them if their condition has changed, if it has not, then they are told they are eligible. The only patients who are being told that they are not eligible are those who very specifically, and I have, believe me, gone through every permutation, and 3 of our clinical directors have gone through every permutation of the checker. All of us have gone through it and found that it is in complete compliance. How do we add the EMIS message if they have booked in already? I don't think you can add it retrospectively and make it aware and make it available to patients, but we did send out a reminder to all practices about 3 weeks ago asking them to add this, and we have sent out another update with information on how to add the EMIS message to the screen in the last 10 days or so. Again, if you're not sure how to add that EMIS message to your screen, the front page screen of Patient Access has the COVID message on it. It is the national COVID message, and it has been mandated by the NHS. However, your appointment screen, you can add that message in. I'm afraid I'm not an expert on EMIS, but if you send a note to EMIS, to the Patient Access Support team, they will be able to add that, to tell you how to do that.
Great stuff. Thank you very much. So now we'll hand over to Millie, who will have a walk through some of the information that is available through patient.info.
Thank you. So hi everyone, I'm Millie and I'm in charge of editorial at Patient. So patient.info is the content arm of Patient and the sister to Patient Access. We cover several types of content. These include around 1,500 patient information leaflets. Oh, sorry, you can change the screen, change the slide. Thank you. 1,500 patient information leaflets on a wide range of conditions, which are written and clinically approved by our team of doctors. They're all written to be easy to understand for all patients, so you can be reassured that your patients will be receiving genuinely useful and accessible information from these. We also have around 2,000 professional articles which are written by and for those working in healthcare. Our thousands of medicine leaflets are all written by clinical pharmacists, and they'll be reviewed by another. And as with all of our clinical content, these are regularly updated, including if we receive feedback from the public. So the exciting bit for me and what I mostly work on are our editorial features. These aren't clinically heavy as what's been previously mentioned, but all of these contain accurate and clinically approved health information. They're all written by our small but very, very talented team of freelance health journalists. I will go into these in a bit more detail in a bit. So we've also created a number of tools, quizzes, questionnaires, which are all available as an aid to help people identify and understand their symptoms. And naturally, we use these to encourage people to seek help if a concern is identified. So on the site, you'll find a symptom checker as well, where the results will almost always have an attached patient information leaflet, so people can find out more about their symptoms. We also have patient community forums where patients are able to discuss their symptoms with others in a safe and monitored environment. And finally, as you can see in the middle of the screen, we offer a weekly newsletter which covers themed health content. This includes a comment from Dr. Sarah and a range of relevant editorial features, recipes, tools, etc., as well as signposting people to patient access services if it's relevant and feel they could benefit. It's worth noting that more and more of our content is becoming available through the Patient Access app and website, so even more people are able to access our content from whichever avenue they come into. If you could change the slide, please. Thank you. So in terms of flu, this is just a sample of some of our flu content, and as you can see, we have a range of tools at our disposal. So it's my job to make sure that we're issuing a really cohesive and far-reaching flu campaign this year. So we work with our marketing, design and clinical teams to make sure that the public benefit from our content as much as possible. So from the very start of the COVID-19 pandemic, I was covering the emergence of this mysterious new virus, and I'm really proud of what we've achieved in our coverage over the last several months, especially in the run-up to and the duration of lockdown. So far, we've published over 90 features directly related to coronavirus and wellbeing during the pandemic, but many, many more which have helped people to look after their health over the last several months. And we've been really responsive to frequent changes in guidance, the changing health landscape, and we've even received NHS praise for doing so. And I think the positive response to our coronavirus content is a fantastic example of how effective and impactful our campaigns can be, even with a virus that we started off knowing absolutely nothing about. And last year we ran a really successful flu campaign to drive private pharmacy and NHS flu jab bookings through patient access, and encouraging readers to check their eligibility using the eligibility checker we've just seen. That campaign saw us publishing a large number of flu editorials and sending tens of emails to remind people to book flu jabs. And I have no doubt that as our focus shifts only slightly from one virus to another, that we're looking at a really, really important and hopefully really useful season of content for our readers and the healthcare professionals looking after them. As you can see from this slide, we've already covered a wide range of flu content, and our first feature of the season, as Sarah mentioned, was focusing on distinguishing COVID-19 symptoms from those of flu and colds. We really aim to stay as up to date and relevant with our topics as possible, which is naturally really important. And so as the pandemic, vaccination programme, public health advice, etc. change, we make sure we stay on top of it. Between an idea and hitting publish, our content goes through a number of stages. Journalists will pitch directly to me, or I'll offer them a title of my own. And they often draw inspiration from a number of places, and this often comes from conversations with family or friends. Most recently, a writer contacted me wanting to write about flu myths because a vulnerable relative of hers is adamant that they won't be vaccinated this year, and she really wants to try and change that. So our authors will include comment from at least one or two experts or organisations per piece, and this gives our content a further layer of expertise and really reassures readers that we're sourcing our information from the best of the best. And when it comes to the experts that we're willing to use, we're very to advise someone else if we're not happy with their advice. It's really important that we're always getting the right message across, and Dr. Sarah always makes sure that there's absolutely no way that information could be misconstrued, especially when it comes to vaccination, as we all know that misinformation and myths are rife online. We also often use case studies. One feature in particular stands out when it comes to flu, in which we spoke to a man who suffered the serious consequences of turning down his free flu jab. Case studies are really helpful when we're trying to humanise health conditions and help people to understand their impact, and I think this is especially important during a time when it's very easy to become desensitised to the statistics and numbers around other viruses like coronavirus. So after a feature is submitted, I'll edit them to make sure they fit with our very stringent editorial guidelines. I'll pass them on to Dr. Sarah, who will make sure that that any clinical errors come up, that if we can add in any extra health information, then we do. Then they get proofread by our brilliant proofreader Roz, who is really great at making sure reads and will be understood by the majority of readers, because we always want our content to be very accessible. Imagery is also important, and we make sure to avoid images like needles wherever possible, as we all know that that can scare people from getting vaccinated, especially if they're scared of needles or injections. So I hope that gives you a quick explainer and a bit of an insight into how patient.info is supporting patients and clinicians this flu season. There's a wealth of information on the site, and it's only growing each day. And as we're only just getting into flu season, there's a lot more in the pipeline as we are trying to encourage people to protect themselves and the NHS this winter.
Please. Thank you very much, Millie. Next, we're going to hand over to Matt Freestone from MJOG. He's going to explore some of the new innovation they're bringing into their SMS text messaging. Hi, Matt, can you hear me?
Just as it switched to me. Are we good?
Hi, Matt. Can you hear me?
Hello, everyone. Sorry about that. My computer just gave me straight a power cut, essentially. So hopefully you can get going again now. Yeah, restart essentially. So I'm Matt from EMIS. Are we back up to normal speed? We're having issues on my end here.
We can hear you fine, thanks, Matt. Carry on.
Sorry, Jamie. On to the next slide, please. So EMIS over the last flu season, we were sending 5,300 flu messages per hour. And that is for 3 months consistently. And in that time, we also delivered 37 million appointment reminders. So needless to say, last year was busy. Coming up for this year, next slide, please, Jamie. Next slide, please. I'm not getting anything on this end.
Do we still have Matt on the line? I think we may have lost Matt. Just while Matt is dialing back in, Brendan, do you want to pick up on Matt, or would you rather wait for him to come back on?
Hello there. Yes, sorry, Matt's just having a reboot of his system at the moment. It appears we're having some dramas on there. It was all getting a bit bandwidth restricted for me as well. Sorry, I was just switching my headset off mute. What was the question there, Jamie?
I was just asking if you wanted to continue or wait for Matt.
I suppose yes, I'll wait on Matt. This is his presentation.
Hi,
I'm kind of there we go. I'm sat in the background doing any questions that come in. So but now we have our man back.
Hopefully me leaving and rejoining has fixed things. Is that better now for you guys? Apologies about that.
That's all right. This is some of the fun of Microsoft Live events.
Yeah.
Just checking, I've got how are we helping? Is that the slide you want, Matt?
Yeah, that's wonderful. Thank you. So just to go into how we're helping out this flu season. So in the last slide, you saw that we're doing about 3 times the amount that we were doing last time. And yeah, so this year, how are we helping? So for 2020, we've created a barcode feature that was submitted via our EMIS Facebook community. And from that, we have built our new tool. And what that allows clinicians and GPs to do is send a patient their NHS barcode, and that makes flu clinics lots faster. So you can scan those with a 1 or 2D scanner, and it saves all your printing costs as well. We're also, of course, do automatic read coding. And we've created a few guides as well. Jamie, next slide, please. So this is what a barcode will look like for a patient when they receive it, and that will be opened on their smartphone. And of course, they can send it to their computer to print off if they want to. And if your patient hasn't got a smartphone, it's easy just to request that as a normal, as through a letter by ringing your practice. So this really helps speed up flu clinics. What we're finding that our clinics are doing, our practices are doing, is they'll use their scanner and they'll upload these into a CSV file or a text file, and then upload into the clinical system to basically register their attendance. So this saves a lot on printing costs, and is a feature that you can enable on any of your campaigns, attaching this to any campaign that you wish, or an instant message through my desktop GP. Next slide, please. So, of course, EMIS does automatic read coding of message delivery and also the accepting of their flu vaccine. On our EMIS Smart, this also is easily, you don't have to reply with a certain number or a certain word. You can just press a nice little button, which is very handy. This is all automated in bulk to save you time. Next slide, please, Jamie. So what have we produced this year? So myself and Brendan have been busy creating lots of video guides and PDF guides. So our YouTube channel is a big focus for us, and essentially we produce lots of guides on how you can do the basics in MJOG and also the more advanced bits. We had a webinar last week and we had 800 people register, which was absolutely fantastic for us. And I think they got lots of use out of that as well. We are seeing lots of flu campaigns, as you saw in the first slide. So if you do need to have a guide on how to use MJOG, we are looking to upgrade our interfaces and our user experience. But for the moment, our YouTube channel will give you all the guides that you need. Next slide, please. In addition to that, this is the time of year where we get lots of support tickets. So our support team is being bolstered by new team members almost every month at the moment, and what we're doing to support that is a upgrade to our knowledge base and support centre in the coming months as well. Next slide, please. So our Facebook community is a big focus for us. Since March and April, we have grown by 300-400 members, and it's the fastest growing healthcare community on Facebook. We take lots of suggestions on there, whether it's development or if you just need a quick hand. We're sometimes on there. We don't provide support through Facebook, but you'll often find another member who knows exactly what they're doing. So that's a great resource for everybody. Next slide, please. So to get any more information on our flu campaigns for 2020, you can head to that quick link there, mjog.info/flu2020. That will take you to the quick 4-minute flu guide, and you can also download any PDF guides that you need from there as well. We've got Brendan on the chat for us, and so any questions that you do have about MJOG, how to use it, anything that you need from us, just put them in the Q&A section, and either myself or Brendan will get back to you. So I apologise for the issues I had at the start there. It seemed our bandwidth in the office was quite limited, and glad to solve that again now. Thanks very much, Jamie.
No problem. Thanks very much, Max. Thanks for sticking with it. Appreciate that. So next, I will hand over to Shelley from DocMail, who will explore a similar technology, but using traditional print and mail services for some of those more traditional or harder to reach vulnerable individuals. Over to you, Shelley.
Hi, everybody. So I'm Shelley. I work for DocMail. As many of you will know, we work with about 4,500 doctors' surgeries on a daily basis, supporting them with their everyday letter sending and communication needs. In peak flu season, we work with about 6,000 surgeries, supporting them with their need to engage with patients with clear messages and to have positive outcomes from sending their mail. DocMail season this year, flu season this year, is slightly different, and we've had more engagement with the barcoded letters that we can send out. Barcoded letters have been around since about 2012, but as you can imagine, under certain COVID situation now, that we're getting more and more uptake on the barcoded letters that can be sent out from surgeries. And this year it's even more important in making sure that your patients understand the important information and how things may have changed from when they last attended the practice, and that the best way for that communication to be sent out for a clear understanding is by a letter. Next slide, please. So DocMail barcoded letters. Barcoded flu clinics, as I've said, have been around since 2012, and that they have been very, very successful. They work really well when you've got a PCM who are wanting patients not maybe to come to the surgery, and they may have different locations, or they're actually doing flu clinic days where people can turn up to the clinic. They act as a track and trace for the patients, and this information can be put back into the patient's record once they've attended the clinic by using the barcode. One of the great things regarding the barcoded letters is that it minimises the face-to-face contact during the appointment, which is key for the patient and for your staff. Dr. Mark Barcode Flu Clinic Guide is something that we've set up this year and has proved to be very popular. So please let us know if you would like a guide link emailing over to you. That's something we can do. One of the things that has worked very well this year with more engagement regarding the barcoded letters is that you are able to set up a letter to test. So That's free of charge with all our support, and making sure that you're confident in what you're doing prior to sending out any bulk mailings that you may be doing, and to make sure that the scanner that you're going to be using is working and that fonts, etc., are all set up correctly to limit the issues that you may have on the day of the clinic. Next slide, please. The barcode setup is quite simple. It's also really engaging because the letter can be set up to where there is a return slip at the bottom of the letter that has the barcode on it, but also engages with patients to make sure that you are capturing the most up-to-date information for them, i.e. home phone numbers, more than likely mobile numbers changing, and ever so frequently email addresses that are constantly being updated by patients. So it gives an engagement so you can keep key information up to date at all times. Again, on the information pack that we have available, it talks about font sizes and what to put in your letters and gives you more detail. Next slide, please, Jamie. So the barcode letter, as I've said, has been very popular this year, but also popular as ever is using the DocMail print driver and the website. Linked with EMIS, so everything still sits within your clinical system as it would if the surgery had manually done the letters. It gives you lots of flexibility. You may have staff working from home that now need to be sending out mailings. The print driver and the website can be accessed from anywhere. You've also got the data and security and GDPR compliance. Again, whether staff are in the surgery or working from home, you know that everything's going to be GDPR compliant. It's a simple file print exercise if you're using the print driver, or if you're doing a large bulk mailing, you can have our support in getting that mailing up and running via the website. If you're using the website, you can have all your documents preloaded into the library. That makes it very easier to use each time that you are sending a letter out. You can have profiles and attachments, everything set up in there, because you may be doing your bulk mailings in small batches, or you may be doing them in large, dependent on what your search needs. We can handle the requirement to whichever size the mailing may be. It's also really COVID secure. You've not got staff managing the letters by actually touching them, etc. So it's contactless with the staff. It's unlimited access. So if you have more staff engaging with patients and making them appointments, it doesn't matter how many users you have on your DocMail account. It doesn't matter how little letters they're sending out or how many big letters they're sending out. The access is there and available to all staff. You have the total budget control, so you can see what you're spending. There's no contract and there's no setup fees, and most importantly is you have that full support from our DocMail support that work from 8:30 till 5:30 Monday to Friday, and are at hand to assist when you actually want to do the mailing, if you want the support live, or to give training before you do the mailing, whichever suits you really. It cuts out staff time, so you've not got staff wasting too much time preparing the letters ready for them to send out. And as I've already said, free training, which really is worth you having a look at. It normally takes about half an hour. That can be done one-on-one, or that can be done in group remote sessions at the minute, but it is really worth keeping up to date probably each year if you're only a seasonal user to DocMail, making sure that you're using the system correctly and getting the best from the system. The half an hour session can save time later down the line when you actually come live to using the system. Next slide, please. Thank you for your time. As always, DocMail are always happy to give any demos or training that's needed, but also at the minute to send you the link for the free barcode login pack that we've created for you to use. Thank you.
Fantastic. Thank you very much, Shelley. Thank you very much for doing that. Next, we're going to hand over to Debbie Hughes from Exxon, representing the Surgery Connect product, who's going to talk through how you can help to manage this flu season and the flu clinic appointments and triage calls through their cloud-based telephony. Thanks, Debbie.
Thanks, Jamie. Hi everyone, I'm Debbie Hughes and I'm Head of Sales for Exxon, the company that provides Surgery Connect. Surgery Connect is a cloud-based telephony system which is based on sophisticated contact center technology and offers surgeries a telephony solution which will enhance the patient experience when making telephone calls into the surgeries. With telephone first in mind, managing your telephony traffic has become increasingly important, and Surgery Connect helps by providing you with the tools to ensure that you can manage your call traffic effectively and efficiently with the needs of both patients and staff in mind. Our integration with EMIS Web also helps to identify patients quickly when they telephone the surgery, and our click to call from the patient record helps GPs to manage the ever-increasing demands of triage calls. Specifically in relation to the flu season, we have some extra tools to assist with managing the demand on busy surgeries. You can quickly and easily add an extra menu option into your call flow using a browser-based call flow creator called Xflow. You can either direct call us to an automated booking appointment system or a dedicated team of people who will manage your flu clinic appointments. Whilst patients are in the call queue waiting to be answered, we can play them announcements of days and times of forthcoming flu clinics, providing another prompt to make sure they book their first appointment. We can also automatically send SMS messages to patients waiting in the queue with similar information. And again, this is done using the Xflow call flow creator. All system configuration changes can be managed by surgery staff themselves, or via our dedicated UK support team at no extra charge. So whichever way you decide to do it, it's quick, simple, and doesn't cost you any extra. At your peak times, when your patient call queues are at the highest, we can implement our valuable feature called Queue Buster. When patients join the call queue, they are offered an option to hang up, however, they will retain their position in the call queue. When they reach the front of the queue, the system will call them back, and the call will be distributed to your team from there. So instead of patients hanging on, listening to on-hold music, they can go about their busy day and wait for the system to call them back. After, say, 3 attempts, if they're no longer available to take the call, we will automatically send them an SMS message to say we tried to call back and ask them to call the surgery again when they're free. In addition, we can offer queue prioritization for flu calls so that patients can skip ahead all of the calls and again to a dedicated team of people, which will leave your reception staff free to take normal appointment calls. We also send patients immediate confirmation of their appointments by SMS and remind them again 24 hours prior to their appointment, helping to ensure that your DNAs are kept to a minimum. We also it's important to know that all SMS messages sent via our system are included in the Surgery Connect package, as are all calls to UK landlines and mobiles. Therefore, all of these features are available at no extra cost to the surgery. Thanks everyone, and I hope that helps to understand how Surgery Connect can help you in the flu season.
Great, thank you very much, Debbie, for giving an overview of Surgery Connect and how it can help with the flu and winter season pressures. And finally, we have Zubair from ARC Health, who's going to talk through how you can perform some of those remote examinations within clinics or in care homes. Thanks, Zubair.
Yeah, thanks, Jamie. Next slide. My name is Zubair. I'm a GP by background and co-founder of ARC Health. And at ARC Health, we're trying to combine advantages of online healthcare with offline healthcare. So a couple of years ago, we developed this ARC Station, as you can see here on the screen. And this essentially allows a real-time video consultation to take place between the clinician and the patient. However, we can also do contactless remote examination. So the clinician can be in location A, patient can be in location B, and the clinician can look into the throat, look into the ears, listen to the heart and lungs, of course, very important for flu season, and of course, importantly, exclude sepsis as well with blood pressure, temperature, blood pressure thermometer, and a pulse oximeter. Next slide, please. Next slide, Jim. Yeah, thank you. So as you can see here, this is how it works. On the left-hand side here, it's a patient sitting in front of the ARC station. On the right-hand side, it's a doctor beaming in to the ARC station. And we're using this across multiple settings across the NHS over the last few months, and we'll talk about how we could help during flu season. Next slide. So there's three main use cases for this during flu season, of course. So first is in care homes. So if you can think about if an ARC station is installed in a care home, it first of all, of course, it saves time for the GP to do a home visit because the GP can beam in. It gives quicker access to the carers to healthcare, and importantly, it also minimises cross-infection risk. You're not having healthcare professionals going into the care home and potentially spreading infection around that way. Secondly, it can also be used in hubs and out-of-hour organisations and in hubs. If you think about people who are coming in with flu, you wouldn't know if that's flu or COVID, a first pass, and you might want an ARC station to be in a hot room or an isolation room where anyone coming in with symptoms of flu are actually use the ARC station first rather than having a risk of cross-infection. And importantly, of course, from a workforce planning point of view, every single nurse, pharmacist or doctor who might get a sniffle over the next couple of months, possibly they can work from home rather than having to come in if testing isn't available. And thirdly, of course, GP surgeries, very similar to out of hours. You might want everyone who has symptoms of flu to use the ARC station before to complete the consultation. And again, that just saves the need for PPE. It saves the need for that direct interaction between the patient and the doctor in the same room when either of them could be coughing and spluttering over each other. Next slide. So we've installed these across England and Scotland now as well, in multiple different settings, and it's working quite well. Yeah, next slide. That's it. Thank you.
Great stuff. Thank you very much, Zubair. That concludes the partner presentations that we've had. I'd like to thank very much all of the guest speakers we've had today. Hopefully that's given you a tour of a patient journey, if you like, or a practice journey from start to finish. So using the eligibility checker at the front end, providing information to patients via patient.info, how you'll then engage with those patients and invite them into clinics using some innovative technology via MJOG and DocMail's barcoding via SMS and letters. How you can then manage some of the inbound calls coming into the practice via Surgery Connect and triaging those calls and information around the clinics. And finally, how to provide some of that contactless examinations between the clinician and some of the vulnerable patients you have in care homes where infection control and sort of COVID risk is particularly high at the moment as we brace ourselves for that second wave. So that I hope that's given you a good feel for those solutions from start to finish. Many of them are used in hundreds, if not thousands, of practice. They're getting great use around this time of year, flu season, and indeed into that winter season. We've got a couple of questions. Please feel free to keep them coming in. We've got a few more minutes left to pick up those questions. Got two questions here. Actually, I'll then for two of the partners really. So it's around, can the messages, I presume this is the text messages for appointment booking, be tailored? So first of all, if I can ask Debbie that question. So can the messages for an appointment booking be tailored, or do you pick them from a template? I can see Debbie there. Not sure if you're still on mute, Debbie.
Sorry, somebody had put me on mute at your end. Yeah,
right.
and the message, it is a standard message at the moment. We are looking to improve that, but right now it is a standard message to enable us to send out the same one to all surgeries.
And if I could ask the same question from MJOG, just around how the messages are created, whether those are custom made or whether you pick from templates.
So it all depends on the template that the user wants to send. Really, we have a custom message field that allows for example, if you have your flu clinics to be off-site, for example, in that custom message field, you could say, in a tent in a field somewhere, if you wish, or another site that you manage. So that's all easy to customize, and I'm not sure if Brendan can expand on if there are any guides that we have on that, probably on the support center.
There'll be some guides buried into MJOG support, but it's one of the ones which I've wanted to try and put a small video out of for the last week anyway, so that's something to get created. Absolutely, the templates from MJOG, we do have a range of them all available straight away, and of course not just on flu, but they can all be edited. We don't have a fixed template, as it were. It's all absolutely customizable to the needs of the practice.
Great stuff, thank you. And all the messages, the text messages, those are all added and attached to the patient record, I presume?
Absolutely, yes. So when you're going through sending out a message to a list of patients through MJOG, you get the option to apply a code of your choice, because you all know coding way better than we would. So yes, you tell it when a patient receives the message, apply such and such code. Also, further to that, if you're asking for responses, then it can look for those keywords and add a code off the back of that. So for instance, with flu invitations, you can have a please call practice to book your invitation. If you do not want a vaccination, reply decline. If you've been vaccinated elsewhere, so such as pharmacies and so forth, they reply other. And either of those can be used for then coding back into the system to take some of the admin off your backs.
Great stuff, thank you. Got a question for Shelley at DocMail. The question is around, what do I need to install on my PC? And is there any minimum quantities, or is it pay per use?
There's no minimum quantities at all. And if you're wanting to do the barcoded letters, you obviously will have to buy a scanner, but the print driver is easy accessible and free to download directly from the website.
Great stuff, thank you very much. Another question for Surgery Connect, Debbie at Surgery Connect. Do I need a new telephony contract? And the second question is, can it be used for GPs remote working, or working remotely, sorry?
Sorry, could you repeat the first question, Jamie? Sorry?
Yeah, so do I need a new telephony contract?
Yes, you would need to switch all of your telephony over to Surgery Connect in order to use the services that I've talked about today. We do have a product called GP at Home that could be used just for outbound calls. If people are having, and that I think was the second part of your question, wasn't it, Jamie?
That's right.
Yeah, so about using Surgery Connect for making outbound calls if you're in a position where you have to make calls from home, where the surgery is closed down, for instance, or you're limited on the number of people, or you've got isolation, things like that going on. So yeah, and you can make calls via a different type of product, which is essentially Surgery Connect, but it's just like the different using a soft phone on the computer, on your laptop, and a USB headset. So that's something that I can talk to anybody about if you'd like to contact me.
Fantastic, thank you very much, Debbie. I've got another question for Shelley at DocMail, which is, how do we get Dr. Essop's barcode guide?
If they want to send you their email address, Jamie, I will forward that on to them.
Great stuff. Is that something we could share with people after the event?
Yeah, I'll get that sorted.
To jump in on that one, I think I saw this morning actually there is I believe that Word document for Dr. Essop's guide is also on the EMIS Facebook group. Not
Fantastic.
The MJOG one, just the general EMIS one.
Great stuff. Thank you very much. Cheers, Matt. We'll make sure we get that sent out to everyone afterwards. Final couple of questions I can see coming through. One for ARC Health, Zubair. This is around, can other care providers use the tool once it's installed in the care home? Or is it just GP practices, I guess? You're just on mute at the moment, Zubair.
Yes, we can. So once we install it in the care home, you can have multiple care providers be meant to use the same technology. So that's possible.
Great stuff. And the other question we've got is, are face-to-face consultations reduced using this method?
Yes. So we've got some preliminary data through from some studies we're doing, and it is reducing face-to-face consultations, especially respiratory, where a doctor will want to listen to someone's chest, take someone's SATs, or and particularly for ENT conditions, ear infections, tonsillitis, quinces. Yeah, it is reducing face-to-face.
I think that's important because we've seen I guess a lot of interest in video consultations, and care homes will have some medical devices such as blood pressure, but there's a couple of unique devices such as the stethoscope and the ear, nose and throat Medicam that will provide help you to reduce those face-to-face consultations and do some of that remotely. Yeah,
exactly. We've had some care homes this has been installed in up in Leicester who haven't done a single care home visit over the last 3-4 months because they've got enough diagnostic certainty by using our tools.
Fantastic, thank you. So I think we've exhausted all of the questions that have come through. So thank you very much for submitting those. Dr. Sarah Jarvis from EMIS was very keen for me just to point out at the end that the flu checker is available on everyone's screen without practices needing to do anything. So it should be there for people to access and be able to use. So once again, thank you very much for joining this afternoon. I wish you a very good rest of the day. We'll make sure we follow up with the questions and answers, and of course a full recording and the slide deck. So thank you very much, everybody. Have a great rest of the day.
Thank you.
Thank you.
Thank you.